Welcome to another episode of the Wild and Well podcast. Today I am talking to Kathryn Moloney, who is a fertility and IVF support naturopath, and she's been working with couples to have healthy pregnancies for over 18 years. So welcome, Kathryn. Thank you so much for coming on to talk to us all about fertility and IVF and making babies.
Thanks, Dr. Hilary. Thank you for having me.
Can you tell us one thing that you did today to take care of you before we get into talking all things fertility?
Oh, that is a good question. So I solo got my son to school this morning, and then came here. So let's see. I made myself a decaf coffee.
Amazing. It doesn't have to be big things, right? It can just be that one drink.
Yeah, exactly.
So, can you tell us a little bit about yourself and what it is that you do?
Yeah, sure. So I am a naturopath. As soon as I finished school, I went traveling and I went straight into study naturopathy. And as soon as I finished, I did a certificate in natural fertility education. And I absolutely realized that fertility is where my passion laid and where how I wanted to continue treating. So everything that I did after that really supported that passion and that goal. I worked in a natural fertility clinic and we worked very closely with an IVF clinic. So that is where, usually as a practitioner, there's often a pivotal moment in your career that takes you from, you just sort of, you finish study and then it takes you to a whole nother level. So I, had the most complex cases there and really made huge improvements in people's lives and made babies that probably otherwise would not have been born. This was an extremely pivotal part in my career. And then I worked for a fertility program in Switzerland online for 7 years. And now I'm running my own business called Fertility and Beyond.
Wow, that's a extensive history with fertility and IVF, and amazing that you were supporting people with undergoing IVF treatment 18 years ago. It seems like even still, I know a number of people that are undergoing IVF that aren't considering any of those options to support them in the process. So that's amazing that 18 years ago, some people were getting that.
Absolutely. Yeah, yeah. And you're right. It was quite rare. It really was quite rare back then. And it was a big learning curve because there wasn't the research as there is now. And what I find fascinating is, I love with naturopathy because it's such a sort of traditional medicine. And uh, I, the thing I love about naturopathy is that we've been doing things for so long that are now the research is proving to be true. So I love that in our profession we can see from clinical experience, well, this really works. And, we didn't need to wait for the research to prove that. I remember in about 2013, maybe 2010, the research was done to show that CoQ10 was good for egg quality. And we were like, yeah, we know that, but so great that we now have research to prove that. And now IVF clinics are starting to use it. So
Oh,
yeah, it
that's
has been an
amazing.
extensive experience and long journey with IVF support.
Yeah, incredible. And it must be really validating for all naturopaths out there to be having the science and the mainstream come on board with some of the things that you've been doing for so long.
It is actually wonderful. It is wonderful because we there are so many people out there who need help, and there's not enough of us naturopaths to, help everybody. And also some people don't actually want to see a naturopath or have never thought about seeing a naturopath or haven't been recommended, from a friend or a family member to go and do that. So they don't even consider it. So it is great now that some IVF clinics are actually using these evidence-based supplements to support their patients.
Yeah, absolutely. So, can you tell us a little bit about some of the more common underlying reasons for fertility difficulties? I imagine there are quite a few, but what are the ones that you see as most prevalent?
Well, it's interesting. I mean, over the years, because of what I do, I have seen, and I do see the most complex of cases, which I really love and enjoy. And when we have a successful pregnancy and live birth from somebody who's had extensive difficulty, it is so unbelievably satisfying. So for me, perhaps my what I see as most common is maybe different to what other people will see as most common. Because there are just so many things underlying that can go wrong. There are relatively simple things as hormonal imbalances, and of course we have egg and sperm quality issues. There are then immune and autoimmune factors that play a really, really big part in both sort of egg quality, but also implantation and progression of pregnancy. There are then also uterine and structural issues that can impact fertility. There is a large amount of clotting or circulatory disorders, which actually can impact the progression of a pregnancy. There are, metabolic and nutritional factors. Then there are stress and nervous system dysregulation. There is adrenal dysfunction. And, all of those things that play into that. The environmental causes, the dietary, the lifestyle, and all of that really play a big part of it. And, that's not it. I could talk for ages about each of those, but then also, we have things like, now we're aware that there are uterine microbiome issues that can impact fertility. There are sperm microbiome issues that can impact fertility. We've got all the things like NK cells and genetic mismatches. It's, the list. This is the fascinating thing about having worked in this area for so long, is that, when I think back to when I first started practicing, I was looking at, how are your vitamin D levels? How is your thyroid? How is your, are you having sex at the right time? Do you have good fertile mucus? So these are all the basic things that I was looking at then, but, 18 years later, and the amount of things that I'm looking for now has, tenfold, which is wonderful that I now know these things, but also quite terrifying for the future of fertility. And why the reason I say terrifying is because when people go to IVF clinics, what they essentially think they're really getting is a fertility specialist. But I think what's super important to recognize is that IVF specialists are not fertility specialists. They specialize in IVF. So their intention and their wonderful skill set, they are incredibly well-trained and highly trained and very, very good at their jobs, most of them. But honestly, they are IVF specialists. So they're looking at getting you pregnant via IVF. So there's a very big gap between, say, going to a GP and saying, I haven't conceived for 6 months. Can you do some tests, or what shall I do? And they say, look, this is not my area. Go and see a fertility specialist. Not really realizing that they're actually IVF specialists. So what happens is people often go from their doctor straight to their IVF specialist. And the IVF specialist says, okay, we'll run a couple of tests and then we'll get you started on IVF. However, then people often go into an IVF cycle without having all of these factors looked at. Also at basic level, what are their nutrients doing? Do they actually have enough vitamin D? Do they have a thyroid issue? Do they have a clotting problem? Is there really a sperm problem? Because this is another problem that I see so commonly, is that men will do a semen analysis. It'll get looked at either by a doctor or a fertility IVF specialist, and they'll say, it's fine. The morphology is a bit low. Sperm count is a little bit low. But it's fine. But it's actually not fine. And a lot of the time I see people after they've been trying to conceive for 2 or 3 years, and they come to me and they say, my partner's sperm is fine. I'm like, well, can I have a look at the result? And they show me the semen analysis and I say, that is not fine. That is suboptimal, or actually out of the reference range, because the reference ranges for normal sperm health are way too low. That's a whole nother story of itself, why that is the case. But for a semen analysis to be optimal and fine, everything needs to be normal within those reference ranges, or better than what those reference ranges show. So this is a big problem. I think that not enough extensive testing is done before people actually go into an IVF cycle. And it, in a lot of cases, it doesn't improve their chances of success at all.
It must be quite investigative work. It seems like there's so many things here. And is your job to figure out, I guess your job is to figure out what's going on and how to fix that, right? But where do you start with that? Because you just listed off about a million different reasons why people could be having trouble with fertility. And it makes me wonder how anybody gets pregnant in the first place if there's so
No,
many
right.
different reasons that we could be struggling. Like,
Absolutely. Well, it's funny that you say that because, and I actually do call myself a fertility investigator because that is really where I put my effort. Like I'm sure I'm going to ask people to improve their diet and lifestyle, but that's only going to work if we look for the underlying cause. So, a few years ago, I realized, oh, actually, what I am doing here is fertility investigation. And to do this optimally, I need a structure to help my patients help them to navigate all of this. So I actually created a program. It's called Fast Track Your Path to Pregnancy, and it's a 6-week program. And what I do in that is I actually give a summary of all of these factors in there so that people can actually understand what all of these factors are. So they're not just flying blind. So, they might think, I have no idea whether I have a clotting issue or not. It's like, well, okay, well, did this happen to you? Well, yes, it did. Okay, well, the cause of that could be a clotting issue, it could be an immune issue, could be this. Let's go and investigate that. And then I can give people the actual tests, referrals that they need to have done so that then we can investigate actually the underlying causes of their fertility. So once we identify that, then great. Then I'll give you some very specific dietary and lifestyle recommendations for you. So you're not just tired and exhausted from trying to do all of the dietary and lifestyle things that you probably don't necessarily need to know how to do or need to do. Um, because once we identify the underlying cause, your chances of conception, they increase so much. So yeah, the program's really helping to really support my complex fertility patients to navigate and be empowered about their own fertility. So they're not just turning up at an IVF clinic going, "Can you get me pregnant?" And them going, "Well, we'll give it a try." There's much more deeper understanding, and yeah, some of the it doesn't take long before people are finding underlying causes, and there are barely any of the underlying causes that we can't treat either with functional medicine and or uh, Western medicine.
that's really hopeful because it seems like infertility struggles are really, really common and becoming more and more common. But that's so hopeful that if we can look at what is actually going on for each of us personally, then we can do so much about it and have positive outcomes. That's amazing to hear.
Yeah, it really is. And I just, when we when we find an underlying cause of somebody's fertility who's been trying to conceive for years, like it's just like a party, honestly, because the penny just drops for them that everything they had tried to do previously may not have, it wasn't working because we have now identified this. And, the chance of them conceiving in the future is so much higher. And then they know that then they know what supplements to take for their fertility. They know what dietary and lifestyle things to do for their fertility in relation to this underlying cause. So they just feel they're not just throwing everything out in the air and see what lands and what helps. Like they really have a tailored approach that is specific for them, and it's so empowering, and so it really restores that hope that people have just lost after years of trying to conceive. Even 6 months, even 6 months is, or even 3 months is hard if you haven't conceived after that time. So, the quicker that we can get people into finding out their underlying causes, then hopefully shorter the time for them to get to try to conceive it will be.
And do you recommend that everybody, like in an ideal world, goes through that process before they start trying to have a baby, or is that just for people who are having difficulty?
I would say that's just for people who are having difficulty because I think for anybody who is if it's a planned conception, I would say 6 months before, book in with somebody like me. We can do basic testing or even extensive testing. So it depends how old you are, depends if you've had any prior reproductive issues. We'll be able to assess if you are going to need some testing to rule out any potential issues. So, but in general, anybody who, say, if somebody's 30, they have had no reproductive issues, what I would say, they're booking with someone like me, we'd recommend doing sort of a detox where you actually start having a healthy lifestyle, making dietary improvements, doing some sort of liver improvement. We would then look at each of the systems of the body and see what you need help with. Is it your liver? Is it your digestive system? We'll get you in a really good state of health. And then the 3 months before you do try to conceive, that is a time where you don't have alcohol and, but I'm never one to say like, don't do this, don't do that, because we don't want people abstaining from alcohol, not going out with their friends, not having fun, getting stressed, because then that negatively impacts fertility. So there's a very fine balance of doing things to improve your fertility, but doing them in a way that doesn't harm your fertility. So, but generally it takes 3 months for the eggs to mature and the sperm to develop. So anything you do in that period of time is then going to impact the sperm that is used at the sperm and the egg that is then used for conception to create the embryo. So the 3 months before trying to conceive is really a very important time. But then I would say, if people haven't conceived within 3 to 6 months, you'd come to me potentially and do this program where we look at all of those underlying causes. However, in a different situation, if you're 42 or 40 or you've got a low AMH, I would do this before you start trying to conceive, because you just don't have that time up your sleeve. And I'd never like anybody to feel time pressure, but the longer people take to conceive, the more time pressure there is. So it's good to get onto it in preparation.
Yeah, that makes a lot of sense. If you're older, you just have less of that time to make those changes and not be too concerned about investigating other underlying possible issues.
Yeah, that's right. And I remember when I tried to conceive, because I had all of this knowledge, um, I did immune testing and I checked my microbiome and all of these sorts of things that I knew were miscarriage factors. So it was amazing when I conceived, I just had absolutely no fear about miscarrying at all, because I knew that I'd already been tested for these things that could increase the risk of miscarriage. And that was such a nice feeling, just to know those things. And they're good to know for your life anyway. And often, people come to me in their 40s and sometimes they say, oh, why do I need to do all this testing? And I'm like, well, this is for fertility, but look, mate, who else is going to actually do all this thorough testing and look at your results in details? Because by the time we're 40, we've already had, half a lifetime worth of environmental exposures, alcohol, sometimes abuse, or drinking, and people might have smoked cigarettes, and poor diet, poor lifestyle. So even just checking out all these things, and that's where that 6 months before trying to conceive comes in. You check out all of those things, you improve those areas, you improve your cholesterol, you improve your thyroid, you improve your liver. So then for that 3 months before you try to conceive, then you're already in a really good state.
And what age are people typically when they do come to work with you? Is it that 40 plus, or are you getting all age ranges?
I'd say I get anywhere between 32 to 45. Yeah, typically in the past, I would say most of my patients were over 42, probably. And now anywhere between 32 and 45.
And is that because fertility struggles are becoming more and more common, do you think, or because people are being more proactive, or both?
Hard to say. Hard to say. I mean, often, with visibility, it's really who finds you. So it depends, I guess, what platform you're on and what ages they're using it. And I It's hard to say. Yeah, I can't give an answer of why that is.
Yeah. So you were talking before about a number of different underlying reasons, and one was autoimmunity issues, like autoimmune disorders. Can you explain a little bit about like how that impacts fertility and why people would want to look into whether they have one of those or what to do about it?
Yeah, sure. So when you have an autoimmune issue, you have antibodies. So, for example, if somebody has Hashimoto's thyroiditis, it means they have an autoimmune condition of the thyroid. What happens then is that these antibodies cause inflammation, and fertility does not like inflammation. So, what can happen is you end up with this kind of systemic inflammatory issue, and that can really impact implantation and pregnancy progression. I guess the other thing to note with autoimmunity, I mean, there's autoimmune, so many different autoimmune conditions, but uh, autoimmunity, okay, it's complex to explain. When you become pregnant, your immune system needs to change so that your body doesn't identify the fetus as being different from you and then remove it from the body. So this is what happens in a regular body when a body becomes pregnant, is that there's that immune system shift. When there is autoimmune issues, that shift is really complicated and can actually not occur as it's meant to occur, and then the body will actually terminate the pregnancy. So that is very important to identify. We need to then sort of down-regulate the immune system so that it's not actually doing that.
Yeah, right. Okay. So that seems like a rather important thing to look into.
Rather look at it. Yeah.
And I know you're saying that every individual is different and it depends on their underlying reasons for having fertility struggles, but what are some of the more common things that people could do when it comes to food or nutrients to help just improve their fertility overall? Are there some basic standards that we should be aiming for?
Absolutely, absolutely. So, healthy fats is really important. So I remember years ago seeing this wonderful picture of two embryos sitting next to each other. It's an egg or an embryo. I think it was an egg cell, sorry. It was a woman's egg cell. And one of the eggs came from a woman with healthy, very good levels of omega-3 fatty acids. And the other one had low levels of omega-3 fatty acids and high levels of trans fats. And the cell wall on those eggs was completely different. So the cell wall, and this is what we're talking when people, when they talk about egg quality, there's this idea that everyone knows what egg quality is, but do you really know what egg quality is? Really the big important factor with egg quality is the strength and the health of that cell wall. So yeah, it was beautiful to see the difference in those eggs as to when people had a good intake of healthy fats or not. So yeah, certainly concentrating on omega-3 fatty acids. So extra virgin olive oil, fish, good intake of fish. Fish is a little bit complicated because we need to be very careful about what fish we're eating from the ocean in terms of heavy metals. But certainly avocados are wonderful. Wild caught salmon and sardines are probably the best types of fish to consume. Stay away from your tunas and your big, large fish. And nuts and seeds. So they're all really, really good sources of essential fatty acids. And we just want to stay away from those sort of inflammatory trans fat oils, such as, canola, soybean, sunflower. We just stay away from those. Protein. So I'm all about protein. Protein is so important. It's the building blocks of muscles, and it keeps your blood sugar stable. So healthy blood sugar is something that I see is very, very problematic. A lot of people are on their way to being pre-diabetic and they don't even know it. So, we want to make sure people are having good levels of eggs, and if they eat meat, then grass-fed beef and organic poultry. lots of bone broth and collagen, and then also your plant sources of protein such as lentils and beans and chickpeas and all of that. And if you do have that, you need to combine it with, say, a grain, which then creates a complete protein. In terms of other things, fiber is certainly very, very important. So, fiber is way underestimated in terms of its benefits for healthy gut function. So, a lot of people know about probiotics, but not a lot of people know about prebiotics. People take probiotics, but they don't think about their prebiotic intake. So if you don't have good prebiotics, then the probiotics can't feed on anything. So leafy greens are fantastic for this, cruciferous vegetables, so, broccoli, cauliflower, Brussels sprouts. Fermented foods are really, really great for that, and also berries. And yeah, in terms of, we just want to make sure also that people are having really good levels of, those macronutrients. So getting lots of foods with vitamin D, getting lots of foods with zinc, your pumpkin seeds and that sort of thing. But yeah, just having a really wide variety of colors. The colors in the vegetables are the little higher levels of antioxidants. So, purple carrots, orange carrots, berries, beetroots, all that sort of stuff are really, really, really important. So yeah, all of those sorts of basic things I think are, what really make up the cornerstone of a healthy diet that helps to get your nutrient levels increased. But, even with that, a lot of people have genetic mutations that prevent them from actually absorbing nutrients. So, somebody might have VDR-TAC, which is a gene mutation that is going to prevent them from absorbing vitamin D. So, the amount of patients I've had who come to me and say, yeah, my vitamin D has always been low, even though I supplement with it and I get enough sunshine, I just can't absorb vitamin D, or I can see from their list. Or, even though people will eat, red meat 4 times a week, they're still deficient in iron. So, even with a healthy diet, we still need to look at nutrient levels and may need to supplement if necessary.
So is that what you do if those levels are not going up because they have a genetic predisposition to have low levels? You would supplement in those cases.
Absolutely. Yeah, yeah. And a lot of times I don't supplement until it's proven, because sometimes people have already good levels of vitamin D, or they already have really good levels of zinc or iron. So yeah, it's always good to check those before we supplement.
Yeah. And it seems like a lot of people are low in so many things. My husband's a GP and he worked in Australia where it's like sunshine all the time, or that's what people think.
Yeah, that's
And
what people,
most
and they wear
people,
sun
yeah,
and long sleeve shirts and don't and have very low levels of vitamin D.
yeah, because even there, people are still doing all those things you just said and spending most of their time inside. So nobody's levels were coming back. He just eventually just made the assumption that nobody had high levels because nobody did. And everybody tested, everybody was low. And the same thing with so many other nutrients. Like, I don't know if he's ever seen anybody with high zinc levels.
Yeah, that's right. Exactly. Yes, unless you're eating oysters every day, you're probably not going to have adequate zinc levels. Yeah.
Yeah.
Particularly men. Men lose a lot of zinc in their ejaculate, actually. So yeah, zinc is and it's the most probably important nutrient for sperm health. So that's slightly ironic, isn't it?
Yeah. Yeah. Interesting. So, in terms of fertility, then it seems like what we would be eating for having optimal fertility is very similar to just a really good diet.
Yeah,
Is there any
absolutely.
difference that anything that we would want to focus on more for fertility that we wouldn't if we're just trying to stay healthy?
Not really. Um, and it's funny also, this funny that you asked that also, because some of my patients will be like, oh, I'm just sick of eating healthy for my fertility. I'm like, well, do you not want to eat well for your body anyway? And then they're like, oh yeah. Oh yeah. Now that I do know how to eat healthily, of course, I'm not just doing it for my fertility, I'm doing it for my long-term health. And if I'm going to be a parent, or if I'm already a parent, I want to eat healthy so that I can actually, be around here for a long time for my children. So yeah, no, it is similar, and as I say, I think I think the internet has a lot to answer for, to be honest, when it comes to fertility. So, you know, and when you're on Instagram and it's like, eat these 5 foods for fertility, or improve your fertility by doing this. Well, sure, eat those 5 things for fertility, but it doesn't mean you're going to get pregnant. What it means is that these things are good for your body. You need to be healthy. But what I think has happened is that it's become too simplistic. People are wanting to promote their businesses and putting these infographics on of these 5 top foods for fertility, but it's just missing such an important aspect, which is, well, what is the underlying cause of your fertility issues? And then you search for, or someone might post the 5 top supplements for fertility. So people go out to their pharmacy or their health food shop and they buy these 5 top fertility nutrients. They could be the poorest quality supplements on the market. They might not even be what they say. They might, because a lot of supplements are not regulated. People might take them at the wrong time of the day or at the wrong dose, and it actually does nothing, or it negatively impacts their fertility. And what I really struggle with is that things say for fertility, but it's not your fertility. They're not the top nutrients for your fertility. We don't know what they are until we do some testing or we do some case history, and we know what your fertility issues are, and then we can work out what the 5 top nutrients are for your fertility. So I think, one of the questions that I was looking at before from that somebody asked is, why are there so many fertility issues these days? Well, there's a range of issues for that: environmental toxins and later age trying to conceive, and diet and lifestyle, and all of the chemicals that we're exposed to now, and stress, and you know all of that. But I also think the internet is really problematic, because people, rather than thinking, oh, I haven't conceived in the last 3 or 6 months, they go to the internet and they learn things, and they think that they're treating their fertility. So they continue on treating what they think is treating their fertility, but really it's not treating their fertility. They're just taking supplements. And so I think it's unfortunate that people think that they are improving their fertility when they're not, and actually the time that it's taking them to conceive is longer because they're not seeking professional help. And of course, there's that gap there, as I talked about. The GP doesn't treat fertility, so then they refer to the IVF specialist, and then they go into IVF. And of course, when people go into IVF and have unsuccessful cycles, this really sets them back financially, emotionally, physically. And then they're in this headspace of, well, there's something wrong with me because I'm not conceiving. Whereas, my dream is that people know more about people like me, who can actually be that middle step between the GP and the IVF clinic, so that we can do all this work. We can try to get people pregnant naturally. And if they can't, then they then go to the IVF clinic, already looked at all these underlying factors, have done some detoxification, have repleted their nutrient level. So then they go and do IVF, and the chances of success are much, much higher. And I've seen this so many times where people have gone GP to IVF specialist, hasn't worked, have come to me. We work on their fertility. Majority of people end up conceiving naturally, but the ones who go back to IVF have a much better outcome. Time and time again, I just see the outcomes, even though it might be, they might have done the IVF sets, the last IVF cycle 6 months ago, and now they're 42 or maybe, 41, but their outcome has improved by doing the work. So that's my utopian dream, is that people find people like me before going to an IVF clinic.
Yeah, it would change so much, wouldn't it? And people wouldn't be spending that time stressed and thinking that there's something wrong with them, like you said, but they could actually be putting useful steps that are specific for them in place to make themselves healthier overall and increase their chances of having a baby. That's a great
Absolutely.
dream.
Yeah,
Yeah, I love it.
absolutely.
Yeah.
We'll keep working on it.
Yeah, I think we are moving towards that. I don't know if it's because I'm in the motherhood space and half the people I talk to are naturopaths, but
Mhm.
it seems so it might just be my little bubble, but it seems like more and more awareness of people like you and that there is support out there and that there is so much that we can do to support our bodies for optimal pregnancies, not just IVF. Like IVF, yeah, it's really useful, but it's not the only thing. There's so many other things we can do. And I think that is starting to gain some traction. So you're onto something.
Yeah, I think so too. Things have changed a lot in the last 18 years.
Yeah, exactly. Okay, so in terms of you've mentioned detoxification, I think twice now. Can you just explain a little bit about that? Like, what is that? Is that supporting our liver, or is that having us sweat more, or does that have to be really individual and they have to work with somebody like you to know what we need to detox? Can you just explain that a
Yeah,
bit?
this is an interesting thing. It's on my mind at the moment because a lot of children, I see children as well as adults, and you know what? If I do a hair analysis on a child, it often comes up that they have high levels of heavy metals, and this is unfortunate, and it can impact brain development and behavior and all of that sort of thing. So we need to look at that. What a lot of people don't know is that breastfeeding is the ultimate detoxification for a mother. So this is unfortunate, and I would say a bit of a biological problem. So, if a mother has high levels of heavy metals, which she normally wouldn't know, this, and even at lower levels, because the baby's so tiny, a lot of the heavy metals can go into the baby. So what I like to do with my patients is to, do a hair analysis for them and see, are there high levels of heavy metals? So if there are, it's going to it may impact their fertility, and it often does. And then we also know, well, if we don't detoxify this now, then you're going to detoxify when you're breastfeeding. So that's one aspect of detoxification. Another is just that, as I sort of mentioned before, when we're 35, 40, we've had a whole life of inhaling pollution. And if we live in a city, exhaust fumes, or we've eaten food that is in contact with plastic and microwaved food or hot Indian food that's come from the takeaway that's in melting plastic. And most people have used regular conventional shampoos and body washes and makeup and all that stuff. The amount of chemicals that is in our body is, for most people, unless they've intentionally led a clean lifestyle, is enormous. So I like to get these out of the body before somebody tries to conceive. So if we've got this time, and sometimes we don't, unfortunately, sometimes people have already been to IVF that's been unsuccessful. They come to me, they're 42, and we just have to use the 3 months to get them as healthy as possible, to improve their egg quality, improve the sperm quality, check out if they've got any of these immune issues, clotting issues, genetic mismatches, microbiome problems, and then try to get them pregnant. Ideally, what we would do is look at these detoxification pathways. So looking at the liver, looking at the bowels, looking at the kidneys, and making sure they're all functioning really well so that anything that is in the body will actually be excreted. Yeah, and there's other things we can use as well to help get these chemicals out of the body.
Yeah, makes a lot of sense. And it makes sense that as we get older, we're exposed to more. So there's more that we need to detox. How long
And our
do
liver
they,
reduces too. Our liver function reduces, and our kidney function reduces as we age. So it's a bit of a double-edged sword there.
yeah. So how long do these things stay in our system? Like they're all different, I guess, right? Whether they're like fat soluble or
Yeah,
forever
absolutely. And
chemicals.
yeah, exactly. BPAs are known to leave the body relatively soon, but they can do a lot of damage while they're there. Things like lead as a heavy metal is really a very heavy metal and very hard to get out of the body. Mercury, all of that. So just, yeah, it absolutely depends on the substance.
Right. Yeah. Seems like work that we should all be doing, just like the food. We should all be supporting our bodies, whether we want to have babies or not.
Mhm.
So, what advice would you give to a couple who's just starting trying to conceive, or they're about to begin IVF?
Yeah. Oh, okay. About to conceive. They're two different groups. Um,
Okay.
so the ones who are just about to try to conceive, if you have the time to do some detoxification and then preconception care, wonderful. Enjoy it. Don't let it be stressful. Know that it might take 6 months to a year. If nothing has happened after 6 months, then go and see somebody like me. Or if you are older age for fertility, then start working with someone like me before you try to conceive. Um, if you're about to do IVF, find someone like me, do my program, learn about all the underlying factors that could make it more difficult for IVF to be successful. So and hold off. So even somebody who is 42 and is absolutely worried about their biological clock, you are better off to take 3 months to work with somebody like me and improve your fertility before you do that IVF cycle. So many people are so concerned about their age, but we can actually put a hold on your age and support your ovaries, improve the ovarian response in IVF to get more eggs. Like I recently have a patient who is trying to conceive on her own via IVF and donor sperm. She's previously done 2 cycles of IVF and had 3 eggs. Both of those cycles ended up being unsuccessful due to implantation issues and fertilization. But she just had her egg retrieval after doing 3 months of work with me, and she got 6 eggs retrieved.
Wow.
So even though she is a whole probably at least a year older than she was when she did her cycle when she got 3 eggs, she's just done a cycle at least a year later and has had 6 eggs retrieved. So we don't aging is not necessarily linear when we are doing all the things that we need to do to really improve that egg quality and the ovarian response.
Yeah, makes a lot of sense. So, once a couple has conceived, how do you support them during pregnancy?
Yeah, good question. So I do a lot of pregnancy care. A lot of my patients become pregnant. I actually have a package that my patients go onto when they're pregnant so that I see them all the way through their pregnancy at those critical times. So I'll see them a couple of times in the first trimester. So generally, if I know that somebody is trying to conceive, what I'll do is make sure that I've got them on supplements or that they have supplements ready for placental development. So I love I love pregnancy care. The pregnancy outcomes. I've had patients at 44 who've had prior children. They've had a better pregnancy at 44 with working with me during doing pregnancy care, and of course they've done the preconception care as well, than they did when they were 36 with their previous babies. One patient comes to mind. She just had the most incredible pregnancy. So what we do in early pregnancy is particular supplements to really support the development of a healthy placenta. If we can support the health of a really, really good development of a placenta, and I love it when I hear my patients have just had their babies and their obstetricians or their midwives are always like, a huge and beautiful placenta. It's the best feedback you can get. Um, so if we support that placental development early on in pregnancy, before 12 weeks, the pregnancy outcomes are way better. So preeclampsia risk is reduced, intrauterine growth restriction is reduced. Yeah, any issues with clotting are better. There's just so much we can do in the first trimester that then supports the rest of the pregnancy. Making sure that blood sugar control is there. So many people, 70 or 80% of women become unwell with nausea of pregnancy or vomiting of pregnancy. In pregnancy. So we need to support women during that time. And also certainly if they've done the preconception care, they're already nutrient replete. If they can't eat as well, if all of that happens in the first trimester is not so much, it's not so detrimental because they started at a good place.
Yeah,
Yeah. So then the pregnancy care is great. And then I see them all through the pregnancy at their 12-week scan. We, more and more, less tests are being done on pregnant women. And I just remember recently seeing an Instagram post by an obstetrician, and he was saying, I just went to this conference and it's absolutely ridiculous that we've been testing women for vitamin D in pregnancy. It's just stupid. We don't need to test women for vitamin D in pregnancy anymore. And I took a deep breath, and I thought, that is such a disservice to women and their future bone health. If women's vitamin D and calcium is not supported during pregnancy, they will most likely develop osteoporosis later in life. And I will not let that happen to my patients. We will test them through the pregnancy. That my patients will not get anemic. My patients will not need a blood transfusion, an iron transfusion. I believe that pregnant women are not getting supported well enough by the medical profession. And thank goodness now in both Australia and the US, we have ways of getting tests done that we don't need a GP referral or an obstetrician referral, because it can be so hard just to get an iron test in pregnancy. Oh, we don't do it. We don't test it at this stage. Well, it hasn't been tested for 6 months. So what do you think is going to happen to the women's iron levels? They're going to go through the floor at the next test, and you're going to need to do an iron transfusion. So I'm not into that. So yeah, I do that extra level of pregnancy care that I think women need, and particularly those who are over 38 with an increased risk of preeclampsia or gestational diabetes. There's so much that we can do during pregnancy to prevent those things from occurring.
yeah, there's so much there. I love that you do that with your patients. And I work a lot with mothers in postpartum in those early years of motherhood. And I think that probably most mothers are nutrient depleted because we don't go
Yeah.
into pregnancy replete in those minerals, right? We don't prepare our bodies ahead of time. And then pregnancy takes so much from us. And we want to give that to our babies, but it makes postpartum so much harder. Not only like the work that you're doing that makes people actually be able to have babies, but I imagine, yeah, it makes pregnancy and postpartum so much better for everybody, doesn't it? For the baby, for the family. It's changing things for mothers.
Yeah, look, when those babies come out, nine times out of 10, they have, a very high APGAR score. They're coming out just beautiful. They are, they're just such healthy little babies with their, beautiful placenta. And I also have a postpartum package. So I see my patients throughout the first year with their baby. And of course, I can keep seeing them one-on-one after that as well. But I find postpartum care, also like pregnancy care, to be 100% essential. So, I see my patients 2 weeks after their birth, 6 weeks after, 3 months, 6 months, and then we look at solids introduction. And what I find, there's such an idea of postnatal. You know much more about this than me, but there's such an idea that postpartum depression is so common. But I think what's not talked about is postpartum depletion. I think most women have that. And some people's it goes into depression. But if their zinc levels have not been supported during pregnancy, that is a massive risk factor for postpartum depression. So, I think it's anyone who works with pregnant women, I think it's our responsibility to make sure that these levels are being supported, and that after birth that their iron levels are fine and that their vitamin D levels are fine. And if they're breastfeeding, well, they're going to become depleted again. Access to food is hard, and eating properly and all of that. So these women need to be so looked after pregnancy. I really believe that. And yeah, and I also think it's my responsibility to work with them in the postpartum period, because they now have these vulnerable little babies that they're 100% responsible for, with their partner, with or without a partner.
Yeah, absolutely. I love that you talk about postnatal depletion. That's a huge part of the work that I do because it is, I think it's so common. I think there's some mothers out there that don't struggle with it, but they're few and far between.
Few and far between. Absolutely.
So, was there anything that I didn't ask you today that you wanted to talk about, or anything that you think that is really important for people trying to conceive, whether it's their first baby or their second or their third or their fourth? Is there anything that you would like to let people know that we didn't talk about yet?
Yeah, let me think about that. We did cover a lot, which is great. I don't know if I focused enough on male fertility.
Mm.
That is a big passion of mine because of all of these situations that I've encountered with patients who have been trying to conceive for years, and the semen analysis has been told that it's fine. Um, I just think this is so unfair to women. It makes me quite cross. Because the testing for women is usually so much more invasive. And I have seen women who've had hycoses and laparoscopies and ultrasounds and blood tests and all of this that is invasive and uncomfortable. All this time, where if somebody had have actually identified that there was actually a sperm problem and said, well, rather than just saying, well, actually, some of these levels are under the reference range, but it's fine. If they had have been told, you've got a fertility problem, go off and see somebody who can fix fertility. And this is also, a challenging gripe that I have, is that it's usually accepted knowledge that, or understanding that you can't improve, well, both things. You can't improve sperm health and you can't improve egg quality. Now, my practice would say absolutely the contrary to that, but that is not well accepted. So, yeah, there's so many of my patients have been told that they need donor eggs. And then we've worked on the egg quality. They've either conceived naturally or through IVF. So, yeah, I think I just want to say, like, to any of you who've been told there's no possibility for you, or that the partner's sperm quality is fine, don't believe it. There are other options.
Yeah, that's really important because it takes two people, right? And
Sure, for sure. And you might both, it might not be just the guy. I've got this beautiful couple who I saw, and they've got a little girl now, and she had definitely had some fertility issues, and we worked on those, but his sperm not only looked fine, it looked amazing, like possibly the best semen analysis I'd ever seen. But I was still like, I don't trust that. Let's do a DNA fragmentation test. And he came back with really high DNA fragmentation, which is very problematic. So, no one would have ever looked at that. They would never have known with his incredible semen analysis that there was actually a sperm problem. So, we can't just stop digging when we think something is great. If we had not have found that DNA fragmentation issue and treated it, I don't believe they would have that little girl now. Honestly, yes, we did improve the woman's fertility to a degree, but there were still some issues when they conceived. So the fact that its sperm improved was such a vital part of that. And, when I say I don't stop digging, so I have a patient who is pregnant now, and I had seen her for about 2 years, and she had both endometriosis and adenomyosis. So she thought that's the extent of my issues. And I went, it's possible, but we need to dig more. So I had this test sitting on her prescription sheet for 2 years saying, please, can you do this test? And she would say, and I'd say to her every time, because I wanted to dig deeper, every time she'd say, I don't need to do that test. I know what my problems are. It's too annoying to do and it's expensive. I'm not going to do it. Finally, she did it. It came up that she had an immune mismatch with her baby, with a fetus, any fetus that she would have conceived. She had immune mismatch, so it would have been aborted straight away. She took one treatment of a pharmaceutical that treated this issue. She conceived naturally the next cycle. Even with adenomyosis, even with endometriosis. And the good thing was that she had been treating that for 2 years. So, that had a lot reduced her inflammation and definitely would have improved her egg quality. So that gave her the opportunity. But my goodness, I just think, what if she had have done that test 2 years ago when I asked her to do that? I think her trajectory would have been really different. So I'm very happy that she's pregnant now. And it's really, whenever these situations happen, they remind me, Kathryn, keep going, keep investigating, and keep digging until we know that there is nothing else that could be impacting the fertility of these people.
Yeah, there's so many things that we don't know about with our bodies, right? And that's just a perfect
Oh,
example. How would you know that?
no, you would not know. Yeah, you would not know.
Yeah, amazing. Well, it's really fascinating to hear all the investigation that you do and inspiring. And it brings so much hope to everybody if they want to have babies or more babies, that there's so many things that we can do to support
Yeah,
our bodies and our partners' bodies to actually have that.
absolutely. And this is the exciting part. Even 10 years ago, we didn't know what we know now. It's very exciting. And yeah, new tests become available. Now can you believe it? We can test. That is a company that tests the menstrual blood to work out what the uterine microbiome is like. You know, it's incredible. The things that are available now that weren't even a few years ago makes these investigations so much easier and possible.
And can people all around the world do these? Like you work with people all around the world,
Yeah.
right?
Yeah, I have
Uh,
patients in Singapore, the US, Canada, um, Australia. I've actually worked with people in 32 different countries.
Wow. And is it easy for them to access these tests, or is it mainly just those in Australia and the US?
No, they're the you should see my different prescription sheet templates for different countries around the world. So yes, they are different depending on where you live in the world, but in general now there are pretty much tests available for people practically everywhere in the Western world who I work with.
That's amazing.
Mm.
So where can
Yeah,
people go to find out more about you and the number of programs that you offer?
yeah, sure. So my website is www.fertilityandbeyond.co. And I'm on Instagram at fertilityandbeyond.co. My website has the different packages that I offer and also the 6-week fertility program. So that is actually open for enrollment now. I do only take a certain amount of people at a time because I don't want to become too busy and then not be able to support my patients as well as they need to be supported. However, I'm in the process of taking on another naturopath to work with me who I really love and trust and have worked with before. So that's really exciting to help make the knowledge that I have and the program and the structure available to more people.
Incredible. And so the 6-week program, is that one that people work on more independently versus your other pro
Oh,
packages are more
good question.
one-on-one?
No,
Is
good
that
question. Good question. Yeah. So I have, I think, I guess, three distinct things. So just one-on-ones where you can book, one-off consult, and then, follow-ups as needed. Then I have the packages. So the packages are 6 weeks and you get 3 consultations with me over that 6 weeks. And then the program is also 6 weeks. You also have 3 consultations with me, but you get the benefit of all of the online modules that are about 1 hour per week. So it's actually quite a low time investment. I did not want to make it something that people really said, I just don't have time for. And I don't want people sitting in front of their computers more than they need to. I want them, and of course you can listen to it while you're out for a walk or any of that sort of thing, but it's not a big time investment. The great thing about the program too, is that we do weekly lives. So with other people who are in the program at the time, you actually get to hear other people's questions and other people's experiences. And my patients love that. They have gotten so much out of hearing other people's experiences, and also the questions people ask. I would never, people say, I've never thought of to ask that. So they get, even though it's, it's a group call, it's just, we get to have a weekly call all the way through that program. So it's my favorite way of working with my patients, the program, because all of these underlying factors are discussed in this program. So you get a really deep dive into that. It's not too deep dive that it's overwhelming, but it just means that you get this knowledge and information rather than just hearing it from me in a consult, where we just actually don't have time to go into the depths of these things. The people who do the program really, I think, get the best service, and they really get the most in-depth understanding of their fertility, and they just get to hear all the gems.
It sounds like a great program. While you're talking about it there, I was thinking it could be something that you provide to other practitioners to learn so you can spread this around, because we
Yeah,
need more of that in the world. Moms need more of this.
that's so true. That is a really good idea, actually. Yeah.
Well, thank you so much for coming on here and sharing so much knowledge. And thank you for all the work that you do with families, with couples. And yeah, I'm really grateful for you and your time. So thank you.
You're welcome, Hilary. I love sharing the things that I know, and letting people know that there are other ways that they can improve their fertility, and have the outcome of the baby that they so want.